4 ways to overcome anxiety. Natural, medication, types, and more. Welcome to our guide on overcoming anxiety, where we discuss natural remedies, medications, types of anxiety, and more. Overcoming anxiety is a personal journey, and different methods work for different people. Therapy, medication, natural remedies, and coping strategies can all help. Anxiety is a natural response to feeling threatened, causing worry, fear, or stress. It's normal to feel anxious sometimes. However, an anxiety disorder occurs when someone feels severe anxiety regularly, impacting daily life. These feelings may persist for a long time or be disproportionate to the situation. Anxiety can take many forms. Certain situations, like public speaking or driving, can trigger anxiety. Concerns about health, body functions, or relationships can also cause anxiety. Severe anxiety about specific objects, places, or situations is called a phobia. Anxiety often makes individuals restless, worried, tense, and unable to relax. Physical symptoms may include dizziness, nausea, and sweating. In this video, we discuss 4 ways to overcome anxiety and the different types of anxiety disorders. Remember, what works for one person may not work for everyone. If you struggle with anxiety, consider talking to a specialist to find the best approach for you. Let's start with coping strategies recommended by the Anxiety and Depression Association of America, ADAA. Relaxation techniques like yoga, meditation, and deep breathing can help manage anxiety. A balanced diet with regular meals and healthy snacks also supports mental health. Avoiding alcohol and caffeine can reduce anxiety levels. Getting enough sleep each night is crucial for feeling more capable of handling anxiety. Setting achievable goals rather than aiming for perfection can help reduce pressure and increase positivity. Stepping back from anxious feelings can offer perspective and lessen fear. Seeking support from friends, family, or health professionals can make a big difference. Exercise and fitness are also effective in reducing anxiety. Regular exercise can have similar effects to antidepressants by increasing brain-derived neurotrophic factor, BDNF, which helps improve anxiety symptoms. The ADAA recommends 2.5 hours of moderate or 1.25 hours of vigorous exercise weekly, or a combination of both. Activities like jogging, walking, cycling, or dancing are beneficial. Breaking exercise into shorter durations can make it more manageable and sustainable. Let's move on to medications for anxiety. Benzodiazepines are short-term anti-anxiety medications that can be addictive. They slow down the central nervous system by increasing gamma-aminobutyric acid. Beta blockers help by reducing physical symptoms of anxiety like trembling and sweating. Some natural sources, like omega-3, also have calming effects. Selective serotonin reuptake inhibitors, SSRIs, increase serotonin levels in the brain, helping with generalized anxiety disorder, GAD, panic disorders, and social anxiety. Tricyclic antidepressants work similarly to SSRIs, but can have more side effects. They affect multiple neurotransmitter pathways, including serotonin and norepinephrine. Monoamine oxidase inhibitors, MAOIs, increase neurotransmitter levels by blocking their breakdown. They can have dietary restrictions and may interact with other medications. Therapy is another effective way to manage anxiety. Psychotherapy or talk therapy can be done individually or in groups. Acceptance and commitment therapy, ACT, uses mindfulness to reduce anxiety. ACT encourages behavior changes that help alleviate anxiety. Cognitive behavioral therapy, CBT, identifies and changes thinking and behavioral patterns contributing to anxiety. CBT provides lasting skills for managing anxiety and often includes homework to strengthen progress. Exposure therapy, a type of CBT, gradually exposes individuals to anxiety triggers in a safe environment. Exposure therapy is particularly effective for phobia and obsessive-compulsive disorder. Now, let's discuss different types of anxiety disorders. Generalized anxiety disorder, GAD, involves chronic anxiety about various aspects of life for at least 6 months. Social anxiety centers on fear of social interactions and judgment. Swallowing anxiety, or phagophobia, affects eating patterns and can stem from traumatic experiences. Performance anxiety involves fear related to specific tasks, like public speaking or exams. Health anxiety, or hypochondria, is excessive worry about developing health conditions despite negative test results. Sexual anxiety affects both men and women and can impact sexual satisfaction. Relationship anxiety can occur in both new and long-term relationships, leading to behaviors like excessive reassurance seeking. Driving anxiety involves fears related to driving scenarios. Phobias cause intense fear of specific objects or situations, leading to avoidance behaviors. Examples include fear of flying, heights, animals, injections, and blood. It's important to remember that anxiety treatment is highly individualized. What works for one person may not be effective for another. Coping strategies, lifestyle changes, therapy, and medication can all play a role in managing anxiety. Various types of anxiety require different treatments and diagnoses. Seeking professional help for an accurate diagnosis can improve the chances of successfully overcoming anxiety. Thanks for watching our video on overcoming anxiety. Remember, finding the right approach may take time, but support and professional guidance can help you on this journey. Stay strong and take care.